Hello, students of NKT. Welcome to another episode of Test Don't Guess. I am honored to have on today Dr. Eric Nelson. Eric, so tell me, when did you first hear about NKT?
Well, funny. So, as we just said, I've been in practice for 20 years, and I was a student of Craig Liebenson's from day one. Even when I was a student, I had found his information, and I always thought that rehab was such an important part that chiropractors should have in their practice, even though we really didn't get taught much in school. But so studying with his stuff over the years, I always added exercise-based type of stuff into my treatment plan. And as I was learning more about that, once I graduated, I also got into soft tissue work. So I did ART. I've been certified in ART now for 17 years, and I always had a great repertoire of soft tissue treatments. So basically, if someone would come in my office, with lower back pain, I would do ART moves, and I would do, the same 5 or 6 different rehab exercises. And maybe I'd show everyone how to stretch every muscle in their body. And that was basically my approach to begin with. I really had no rhyme or reason for what I was doing other than, hey, there's back pain. I'm going to do ART here. I'm going to exercise there. So over the years, after about 15 years in practice, I'd say I started getting a little frustrated because my results, while some of them were pretty good, some were not. So I was doing a lot of rehab, a lot of soft tissue work, but I never knew how those pieces really fit together. And I remember probably about 5.5, 6 years ago, I was on Facebook actually, and I was in a conversation with Craig Liebenson and some other guy named Perry Nicholson, who I never heard of at all at the time. Mm-hmm. He mentioned something about something interesting. So I was like, who's this guy? So I started looking him up a little bit, and I saw that he had this Facebook page, Stop Chasing Pain, which only had a couple thousand people following him at that time. Now I think the guy's got like 25,000 or something ridiculous like that. But so I barely knew who he was. So I started following him. I was reading his posts, and I mean, at that time he was posting like every 30 seconds. He would have motivational posts, all kinds of crazy stuff. I thought he was a little crazy, but every once in a while he would put in a little clinical thing. And I remember specifically, because I had a patient that I was struggling with hip issues at the time. I remember specifically Perry mentioned something about, I forget the exact relationship, but it was something like the obturator internus was facilitated and the obturator externus was inhibited. So I'm going to treat this and exercise that. And to me, that was like, whoa, what's he talking about? I know those muscles. I know how to do ART on both of those muscles. But what do you mean one is facilitate? Like, I had no comprehension. But I'm like, I thought that was interesting. So I'm like, all right, let me see what that's about. So I scrolled through his Facebook feed a little bit, and I saw he mentioned something about NKT, NeuroKinetic therapy. So I'm like, all right, let me start following NKT. So I started following NKT, and I started reading his posts, and I was like, whoa, this is some pretty crazy stuff. Sounds pretty cool. So I sent David a friend request, became friends with David. I was like, wow, this is pretty amazing. I'm like, how can I learn more? So I remember I was in my study. It was like the winter. I'm like, how do I learn more of this stuff? And I was like, wow, he has a book. This is awesome. I'm gonna get his book. So I go on Amazon. I'm like, $13 or something ridiculous like that. So I'm like, all right, I'm gonna get his book. So I get David's book. I was like so fired up. Get the book. Do I have that book here somewhere? Yeah. Oh yeah, look at that right behind me. Get the book. So excited. Read it from cover to cover in 15 minutes, because it's not really that difficult of a read. But I still had no idea what the hell NKT was all about. Right? I'm like, oh my God, what's going on here? So I was like really excited about it, but I had no idea really what was going on. As a chiropractor, we were taught basic muscle testing in school. Very basic, for if someone has a disc issue, for C5, do the C5 nerve package, which was sensory, and then motor, and motor was the muscle testing. I mean, that's basically all I knew for muscle testing. I didn't really consider it for diagnostic purposes. I never really, in fact, I didn't have a good image of what muscle testing was. So got the book, didn't help. I'm like, geez, and now it's December. I'm like, well, I got to learn more. This is very interesting to me. And I knew from the book he was from San Francisco. So I'm like, all right, let me go to his website. Now, at his website was just a blog at the time. He didn't have a full-blown website. It was just a blog. And pro tip, if you haven't looked at David's blog, which he still has on his website, it's priceless. I've learned so much information that I use on a daily basis from that blog. So I highly recommend checking out his blog. But at the time, it was just a blog, and there really wasn't much information on there about the technique or anything except for his words of wisdom. But I'm like, all right, I got to learn more from this guy. Does he have any seminars? What's going on? So he had a little section on seminars on this one blog page, and I'm looking through and I'm like thinking, okay, I'm in New Jersey. He's in San Francisco. I'll go wherever I have to go to learn this technique. It really, for some reason, it was really speaking to me. So I scroll down his page and I see he only has one class on his website. I'm like, all right, level 1 NKT, and it happened to be in New Jersey, of all places, and even more so, it was in North Jersey. So it was only like 2 hours away from me. It wasn't too far. I was like pretty excited. I was like, what's the odds of this? Interestingly enough, I'm looking at the name of the place it's at. I'm like, this sounds familiar. Well, at the time, I was the president of our state association sports chiropractic council. My vice president, Danielle D'Amelio, she was renting a second office in another place, in a gym, and it turned out that's where the class was.
No way.
So I'm like, Danielle, do you realize you're having this class? She's like, no, I had no idea. So she took the class with me. Finally, and it was December. The class was at the end of January. So I was like, oh my God, I got to sign up for this thing. And I mean, I remember I got to the class, got there nice and early. Class was full. I believe Kathy Dooley was in my class. You know, we had just a lot of people really excited about learning this stuff. And you know, we had no assistants in the class. It was just pretty much David and maybe, I think Perry was in there and one other guy who had just taken his class like maybe a month or two before somewhere. So we really didn't have anybody, but maybe there was like 50 people in the class. But I remember just sitting there, and within the first hour or so, once we started getting hands-on, I was like, oh, the light bulb went over my head, and I'm like, oh my God, this answers the question of why I do soft tissue work or why I do exercise. It really, to me, just brought everything together. And I was just, from that moment on, I was just blown away by the power of NKT. And I mean, it took me a little bit to get it down and implement it and all that stuff we could talk about. But I just remember that moment where it was like, this is what I was meant to do. Finally, someone's going to explain to me why I'm going to treat a muscle. Not just, your brachioradialis palpates tight, let's just start doing ART on the brachioradialis. No, why is that muscle tight? Is it inhibited or is it facilitated? Wow, it's inhibited. Well, I better not treat it. I mean, that was such a mind-blowing thing to me. And it's funny now, you know, when I teach and I share this story and I share a bunch of stories, but, you know, David, now it seems it's kind of funny. Everybody knows, okay, the psoas isn't the answer to all life's questions. But 5.5 years ago, when I was taking this class, the psoas was the answer for everything. I mean, it was like, do the psoas, you know, ART. If anybody has low back pain, psoas. So yeah. It was just like, psoas. So I remember when I seeing David talk, and he's like, don't release the psoas. Again, that was one of those moments. It was so powerful. And like I said, I teach and I go through it, and I see people have a similar reaction, but I don't think it's quite as powerful for us, his first students, that were like, holy cow, this is like life-changing right here. I mean, it was pretty powerful, but I knew from that moment on that NKT was going to be a huge part of my practice. And it's been a great ride since that time.
Yeah, that's really amazing. How long ago was that when you took that first course? I think
it was 2012, maybe. So January 2000. So 5.5 years ago, I think that was something like that. Yeah.
Did they have the levels back then, or was it just the one course?
Yeah, it was. So we had level 1 and then level 2, and which is those two are the basic same concepts. Level 3 did not exist.
Okay.
In fact, I took his first level 3 class, and I'll leave it at, it was nowhere near what it is today.
Okay.
It was like, I don't know what it was. It was an experiment. It was an experiment. But we had level 1, level 2. There was no scholars page when we started at all. Wow. So and there was no study group. New Jersey. I was me and Danielle, and we're the only ones in New Jersey, and I'm in South Jersey, so there's no one anywhere near Philly. No one that did it. So we had nothing. My support group was me calling or emailing David every day, going, "What does this mean? What does this mean? What?" And I remember a couple things of some early on things he said is I remember it got to a point where I was getting comfortable with the testing, and I started asking him questions, and he stopped me. He's like, "You are ready for level 2." And I'm like, I don't have the level 1 stuff down. I don't know all the tests. I don't do this. I don't know that. He's like, your thought process is there. You're getting it down. Let me tell you, get to level 2, which we'll be offering in a couple months, and a lot of things will really come together. And sure enough, because with level 1, there's so much information, and I know that, and it's a little overwhelming. But once you start practicing and you get the concept of neural lockdown, and you start feeling things and you're finding things, your next question is, well, where do I look and why do I look there? And so those were the questions that were coming into my head. And sure enough, once I got to level 2 and we started talking about subsystems and rotation, I was like, oh, that's exactly what I was thinking that I need to know. So it's like level 2 really complements level 1, 2. And I know people are all scared. Oh, I'm not sure. I don't know it. But if you get the basic gist of what we're doing, level 2 will bring it all together. And so many of my level 2 students, I see it in their eyes within the first 20 minutes of class. They're like, oh my God, this is so easy. I can't even believe it. I mean, everyone that's taken level 2 after my class, without a doubt, they're like, oh my God, I wish I would have done this sooner. I mean, it's a no-brainer. But yeah, at that time there was no support, there was no scholars page, there was no study groups anywhere in my vicinity. It was just me and David. And the other piece of advice that I remember early on from David was because he probably got sick of me after a while. I was calling him every day, I was emailing him every day. I'm like, I don't know. He's like, Eric, slow down. So, David, he's so laid back.
Yeah.
He's like, how long have you been doing this? I'm like, 6 weeks. He's like, how long have I been doing this? Over 30 years. I'm like, oh shit. All right. Okay. All right. I'll calm down because we take these classes and we expect Monday morning we're going to solve everyone's problem.
Right.
You see the posts on Facebook. Oh, this, and this. Unfortunately, that's not the way it works. You got to get the repetitions. You got to get the experience. You got to get it. And the more, it's like anything. You practice, you get better at it. But, and that's the truth. That's totally what I saw. In fact, I always tell my students too. And now, previously there wasn't really much of a PowerPoint in level 1 at all when I took the class at all. Now we've got it pretty segmented. Like we start with the core, the Powerhouse 5, and then we move from there. Well, and I always laugh when I tell this to my students is, the first couple weeks or so after class, I never tested the rectus abdominis and the transverse abdominis.
Oh, wow. Never
tested them because I didn't feel comfortable with them. My technique was off. It just seemed weird. Everyone's going to fail. And I didn't do it. And even without doing those, which is so funny when I think about it, I still got way better results than I had ever gotten before. But then after I did level 2, because level 2 he held only a couple months later, I forget the exact date. But after level 2, I went back with a vengeance and RATV. Now I test that on every patient, every single visit, and it's you have to. But it's just so funny because I had no confidence in doing it. But the moral of the story is the more you do it, the easier it gets. And NKT is definitely something that anybody can do. It's challenging and it's a lot of information, but that's why I like to keep it simple. Focus on the concepts, focus on the protocols, get those things. I review in my class all the time. What's a neural lock? How do you find a neural lock? What does it feel like? What is facilitated mean? What does weak in the clear mean? What is strong in the clear? We review that so many times in class because when you go back to work on Monday, those are the things you got to think about. Oh, what am I doing first? Oh, I got to find something weak in the clear. Okay, I found something weak in the clear. Now what? It used to be, deer in the headlight. But now, okay, weak in the clear, directional testing. That's all I want my students to associate. Weak in the clear, directional testing. And if you have to pull out the list, I have, that PowerPoint, print out that slide and keep it right by you. Some people have them laminated. I have on my tablet, the PowerPoint that I put some stuff in, and you just quickly refer to it. Okay, I found a leak in the clear, directional testing, what's the next step? And boom, you just run right through those steps. And sure enough, you'll figure things out. And that's one of the main reasons I love teaching is watching people, figure it out throughout the weekend. At first they're like, I don't know, this stuff's crazy. It doesn't make any sense. But then after they start feeling things on themselves, and then start problem solving a bit, then they really are like, wow, I think I can do this. And that's what I just try to remind the students is like, look, you got it. I mean, you might not know every single test we go over. I mean, I don't expect you to, but you got the neural lock. You understand to go down directional testing. Look at your paper. Look at your PowerPoint, and it's right there. Just follow the steps, and you'll get it. You might not solve everyone's problems in one visit, but you're going to figure this out. And once you start getting results, then you could start worrying about getting people better quicker. But first, get the basics down, get the concepts, get the protocols, move on to level 2. And, and I always hate saying, and I always feel bad when I'm telling my students, but I love level 1. You got to do it. Level 2, you got to do it. But gosh, you got to get to level 3 as quickly as you can. The stuff that we've done over the past couple of years with level 3 is priceless. More and more I see people with ligament issues, with scar issues, with eye issues, diaphragm, pelvic floor. With the level 3 protocol, you can assess everything. It's such a powerful tool. So I really like, I feel bad telling my students, but I'm like, look, because it always comes up in class. Someone has an issue with a scar. Someone has an issue with their diaphragm or their, something. So I'm like, look, we're not going in there this weekend, but look, you can see how powerful this stuff, it comes up very often, and with this protocol, you can really help a lot of people and really figure out a lot of problems. Plus, the level 1 and level 2 stuff will make a lot more sense too. So like I said, I feel bad telling people, but I also, and I've even said it to David, and even during the instructors meetings we've had, is I think we should make people take 1, 2, and 3 in like a certain time frame. That way they're forced to learn here, first to learn that, and boom, they have it. So now they got the whole system down. Because when you get the system down, I think you can really get better results. But what we see, as you see all the time, if you're, working a study group, is people get stuck in level 1 for 2 years.
Yeah.
Like what? I mean, I know you're getting better results, but God, there's so much more you can do with the level 2 and then the level 3 material. I'm not saying you can't solve a lot of problems with that stuff, but geez, it's a package. I said I'm a board certified sports chiropractor. It's a 300-hour course. Plus I had to spend time on the field. I had to write a paper. I had to pass a written and a practical test. Like, it's a process. I just didn't expect to be a sports chiropractor overnight. I mean, it took a long time of work to get there. NKT, it's evolved a lot over the past few years. And the 3-level system, if you can get those down, really, you're going to really help a lot more people. It's really phenomenal. So I can't say enough that I really believe students should get through the levels as quickly as they can.
Yeah, absolutely. And as you've been teaching people and working with so many students, what are some of the huge, just like repeat mistakes that maybe you see students make over and over again that kind of hold them back?
Yeah. And I'm sure all the instructors see the same thing. The first thing, which is why we spend a lot of time on feel and trying to find a neural lock, is everyone, and I was there too, goes way too hard on the testing. I mean, that's the number one thing, without a doubt. I watch people and they crank, oh, it's weak. Oh, it's weak. Yeah. I mean, sure, you could pretty much get any muscle to fail at any time. That's not what we're going for. Trying to get them to understand. We're trying to get the muscle to react. Can we feel that reaction? And it's the same thing with our patients too. If we struggle with our patients, it's because we're pushing too hard or they're fighting too hard. And it's the same concept, trying to get them to understand, look, this isn't a competition. We just want to see the muscle react. And if you press too hard, you're going to miss it. And sure, you can make people fail any test, but what does that give you? It doesn't give you any information. We want to try to be as specific as possible. So take your time, use very light pressure. Sometimes you have to go a little bit more, but very rarely do you have to push hard. I find more and more it's more about endurance, holding it a little bit, because if someone's really cheating and compensating, they're not going to be able to hold it that long. So if you keep that light pressure and you just go a little bit more, they'll fail. And it's like that every time. So I say the number one thing, which is why we spend so much time teaching it, is that feel. Don't press too hard. Lighten up. Get that down. Also, right, piggybacking that is let the patient initiate the movement. You know, if you just start pressing down, they're going to fail. Let them, you know, push into them, but let them initiate the movement. So that's how I start. I say, put your hand on their arm, feel their arm move, and once they go, that's when we can start the resistance. But if you just start it and start pushing, they're going to fail. So those two things, and they go hand in hand, because if they're not testing properly, they're not going to get the results. So that to me is the biggest thing that I see as far as performing the test. I think another big thing is that people really get in their head a lot and get overwhelmed with the amount of material. And that's why I just keep bringing it back, and I'll constantly say, look, slow it down. Think what we're doing here. Concepts and protocol, weak in the clear, directional testing, neurolock. Those, just keep it simple. And when people keep it simple, that's when they start getting it in class. So, but like I see, by the second day, everyone's like, oh my God, this is so much. Calm down. You know what to do. And I ask people, what happens when you have a weak in the clear muscle? And by the end of the class, they're all yelling out, directional testing.
Yeah.
Like, exactly. That's as simple as it is. Keep it simple. You know, don't get, I mean, it is easy to get overwhelmed, and I've been there myself, but the reality is keep it simple and go back to the basics. Weak in the clear, directional testing, and you'll be fine. You know, work on that for a little bit. Once you get comfortable with that, then you could start worrying about, okay, I can't find any weak in the clear. What do I do? All right. That's where relational compensation comes in, right? Then we start working on those concepts. But, you know, again, it's always like slow down, take a breath, and really just keep it simple.
Eric, when you first learned NKT and you started bringing it into your office with people, did you ever have any like really terrible moments of just like, oh my gosh, I don't know what to do, or this did not work as well? Do you have any like really good stories that you could share of just like how you had no clue what to do with it after you first learned it?
Yeah, for sure. I can remember many times I would get stuck on the psoas. Like, I can't find a weak in the clear. I mean, I got a weak in the clear psoas. What do I do? And I can remember spending 15 minutes, sweat coming down, like, oh my God, what am I going to do? What do I do here? So yeah, that happened to me often. And it's funny because now, you know, one big thing that we teach now, it's even a slide in the PowerPoint, is what do you do if you have bilateral weak in the clear muscle, right? So that's one of our slides we put in early on, and we say, go to the core, look to the spine. Well, that one slide, I wish I would have known that 5 years ago.
Oh, wow.
Because so many times that I have a weak in the clear psoas and I can't figure it out, and then I go and check the other side, it's weak in the clear too. And I'm like, oh shit, really? I just spent 20 minutes running around in circles, and then I go like to the spine, and boom, there it is. So now it's funny because, you know, when we teach, sometimes it looks like magic, you know, because we figure things out so fast. Well, again, that's experience. But I'll tell you this, that's been one of the biggest tips ever. And it's so important that we include it in the PowerPoint now, is look for bilateral weak in the clear muscle. That'll save some time. I wish that wasn't even a thought in my head. My thought was, I found it weak. All right, let's figure it out. Now I find something weak. I'll go check the other side. If it's weak in the clear, all right, I'm going to the spine, the core, whatever. If not, then I'm going to come back and try to figure it out. So that, to me, that would have saved me so much time. But, you know, you live and you learn. Just like I never tested the core muscles at first. You know, now I do. It's one of those things, and that's why, again, another reason I love teaching. And as a teacher, and I'm saying these things, I'm like, oh God, I wish I would have known this. That would have helped so much. But yeah, I mean, those are big things, and I struggled a bunch. But the funny thing is I do remember that first day getting back, and I'm thinking, all right, what am I going to do? This is 180 degrees different than what I did. Before, I treated 20 muscles on a person. Now I might treat maybe 1, 2, or maybe 3. How's that going to go over? And I remember that was huge. But you know what? All my patients, I realized, I mean, at first I was nervous, but what I realized is my patients care about results. If they're getting better, if they walk out of that room feeling better, they don't care what I did, as long as they're feeling better. So that was huge. So I remember that first day I came back, I started testing, I found some stuff, I cleared it. Patient looked at me, was like, "That's it?" I'm like, "Yeah, get up and walk around." They're like, "Oh, wow, I can touch my toes better. Pretty cool." So that was nerve wracking, but I just dove in and started using it. And like I said, I didn't do everything. I didn't do the core. I just went to their area chief complaint and started finding things and, finding them weak, and fixing them. At that time, we didn't have the directional testing protocol. So it was, it was a lot less of a protocol. So I did that, corrected them, and they got better. It was pretty amazing. And then as I got better with those few tests, I started adding more in. And then it became easy. I mean, once you get that feel for the neural lock, you can test any muscle any way you want in the body. It's not really a difficult concept. So I just started doing more and more and more. And still, my practice is always evolving. I learn different ways to test things or different concepts that might lead me to different places. So I'm constantly changing, and my patients really appreciate that I care so much. So I think when you start, it's definitely challenging because you're doing something totally different. But once you start, once they start feeling it, and that's a huge thing. You have a psoas that's completely weak, and all of a sudden you corrected something, and now the psoas locks in. That's tremendous. The patient feels that. They get up, they're like, "Holy cow! I feel my hip flexors for the first time. Oh, my glutes! Oh my God!" Like it's such a powerful technique in that regard that it speaks for itself. And that's something. I'm a chiropractor. So my time with people is a little bit limited as far as my sessions, but I know a lot of massage therapists struggle with, geez, I spend an hour rubbing people. How do I, morph into something else? And it's tough. And I know, I always, try to tell my students that are massage therapists to connect with Marissa Macias, because she's really is a master at implementing that. But it's the same thing. Once you start getting results, people will want that as opposed to just getting rubbed all over the place.
Yeah.
And that's what I see. So that's a huge thing. And the other thing that kind of goes with that is, because there's definitely a lot of trainers and people that aren't licensed to touch in our classes. And we teach, and Jackie Wu is great at breaking it down for people and giving people alternatives. But something I've noticed is that trainers that are drawn to NKT, for whatever reason, if they stick with it, they really love it. They love that aspect with it. Then I usually tell them, because they're asking me, "What should I do?" I'm like, go to massage school, get a license to touch. And so many trainers have done that, not because they want to rub people for an hour, but because they want to be able to touch people and use NKT better. I mean, you could definitely do it. And I tell our students, sure, there's plenty of successful trainers, out there that are using NKT, but if that's your personality and you're drawn to helping people, then getting a license to touch really can facilitate the process and really help in that regard. And that so many people, in fact, I got a student that was an engineer, and she's retiring from becoming an engineer, and right now she's in massage therapy school, but she wants to practice NKT is what she wants to do.
That's super cool.
And it was cool. And she's old. She's retiring. She's, a little older. She actually asked me, she said, "Should I go to chiropractic school?" I'm like, no, not at this point. Go get your license to touch. In fact, I recently had a conversation with a younger NKT practitioner. I just saw he passed his level 2 cert the other day. So congratulations to him. But he asked me, "Should I go to chiropractic school?" And I'm like, "Well," or physical therapy school. I'm like, what's your point? Why would you want to do that? Because if you could if you have a license to touch, and you could do cash sessions with people, and they're going to pay you for it, and you could spend whatever time you want, you don't have to worry about insurance. I think that's a great way to go. I like looking back at it now, like if I was like, "Gee, should I go to chiropractic?" I don't know that I would. I mean, the student loans are tremendous. And the way I can practice, there's plenty of massage therapist trainers doing pretty much the way I would practice. I mean, now, don't get me wrong. I like being a chiropractor. I love being a chiropractor, and I can order imaging and blood testing and all that kind of stuff. So that definitely is a whole other dimension of practice. But if I was getting into it late in the game, I think it would be and I really wanted to do NKT. I think that would be the route I would go to massage therapy school. I mean, I
Yeah.
think you can really help a lot of people that way and not deal with all the student loans.
Yeah, yeah, no, that's great. I'm curious, how has NKT kind of changed your practice? I mean, getting more into how you're working, and now we're talking about professions and whatnot. I mean, you had a lot of experience before doing NKT. What
Mm.
are some of the big changes that, like, oh, I don't do this anymore, or now I always do this? How has it kind of changed your practice over the past 5 or so years now that you do NKT?
Yeah, it's really changed the amount and the type of soft tissue work I do. I mean, as I mentioned, I'm certified in ART for 17 years. I'm certified at Graston technique. I was one of the first in South Jersey to do the Graston technique. I honestly very rarely use the Graston technique now. I do very light touch. Even when I do my ART, it's very gentle. I'm
Mm,
very specific. I could find spots or structures that I feel are the highest priority dysfunction, and I can work on those and get incredible results. So my practice looks different in that I do a lot less manual work. I'm a lot more specific. I get a lot accomplished in the short time I have with patients. I spend about 15 minutes or so on follow-up visits with patients, and I get a ton of things accomplished because I think fast and I figure things out a lot quicker. So again, it's a lot less stress on my body. My hands, I feel great. I mean, I don't have any issues with my hands, my
mm-hmm.
back. I mean, it's great. I love it. Again, which I didn't mention, but I started, as I said in the opening, is what brought me to NKT is I was getting burnt out, and one thing was my results, and the other thing was just it was bored. I was getting bored doing the same thing over and over again.
Mm-hmm.
I'm like, ugh. Now every single patient is a different thing. They might have two people might walk in the door with back pain, completely different issues. Completely different issues. And I love being a detective. I mean, I love trying to figure it out. And that to me is the most exciting thing. So my practice is like reinvigorated. I have way more passion. I love doing it.
Yeah.
Even at the end of the day, like this morning I finished and I was like, my last patient, I was like, all right, what's next? Who's next? Like, what
Mm-hmm.
can we figure out? Like I get fired up. It's pretty amazing. And I know my wife was getting sick of me a few years ago because I was so frustrated and annoying
Yeah.
with the way things were going. But this has
Mm,
really just made it much more fun. I mean, I love what NKT has done. It brings in different types of patients. People that are serious. And earlier in practice, I wanted to try to help everybody that walked in my door. But
mm-hmm.
now I realize, there's some people that they're not going to put in the work. Well, then I don't want to work with them.
Mm,
And, using this active type approach, because not only are you treating them, you're getting people to move. You're giving them homework. They've got to move. If they're not going to do the work, well, then I don't want to work with them. And so, it's given me more confidence to just say, hey, look, I think maybe this isn't the type of care for you. Now, granted, that doesn't happen as much, but still, every once in a while, someone comes in my door and I'm like, this isn't for you. And so I've definitely gotten more confidence in that regard with my practice. But it's been fun. I love what it has done to my practice. It's changed. I've had some patients that have been with me the 20 years I've been in practice, and every time they come back, they're like, okay, what's going to be different this time?
mm-hmm.
And they're always excited. They feel better when I help them with their issues, and when they come back, they're excited and they refer their friends. And I'm not sure they know what to tell their friends other than, wow, this guy helps me feel better. And then they come in and we do our thing. But yeah, it's renewed my passion for practice, which
Yeah.
becoming an instructor also, I have to say, that was one thing that really helped me step up my game with NKT as well. I know that there's a lot of people that want to be NKT instructors. I mean, that's a thing now. At the time, David was the only one teaching. Being an instructor was nowhere near my thought process at all. I had no idea to be an instructor. That wasn't even a thought. So when he offered me, in fact, I remember when he said, I'd like you to be one of my first 3 instructors. And I said to him, all right, okay, thanks. Just let me know. He's like, no, I want you to be one of my first 3 instructors. I'm like, all right, well, when you figure that out, let me know. And no, he's like, Eric, seriously, we're starting. You're an instructor. I'm like,
Wow.
oh, shit. Okay. All right. Sounds good to me. But I remember thinking, I'm like, oh, I better get this stuff down.
Yeah.
So it really forced me to get my game together and really and really learn stuff. And it has helped my practice tremendously,
Mm.
which is why I love study groups and, telling people get to study group and practice, work with people, become a study group leader, do whatever. The more you practice, the more you could teach, the better it's going to be, the better your practice is going to be. And that's what I've seen. It's almost funny. When we do our teaching a class and we pick someone out of the crowd randomly and we do a demo and we find stuff, I mean, as educational as that is for the students, it's tremendously helpful for us. I remember after my first couple times teaching, I'd come back to practice and I was like, it was unbelievable. Like I was like, it really seemed like magic. I'm like, oh, boom, 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 boom. And the bottom line is practice and experience. And so becoming an instructor really forced me to do those things, get practice and get experience.
Yeah. Yeah. That's great to hear that it was so good for you, good for your practice, good for your clients, good for your marriage too, apparently. It
was, well, so let me go back a second and I might as well share this too. I think that the reason I became an instructor or was asked to be an instructor was because of my wife.
Oh, really?
So I was doing my level 1 certification and she was my client. And, I did the certification with David because he was the only one certifying people at the time. He was the only instructor. And I did my certification with her, and I stepped out of the room to get a drink because I was like, okay, I gotta take a breath here. So she was on the Skype with David, and she said to David that David, I want to thank you for, introducing this technique to my husband. He really loves it. It's helping him a lot with his patients. And really, he's become a much more pleasant person to be around.
That's so great.
And he absolutely loves this stuff. So I think that must have connected with David a lot because it really did. It really did. I mean, it changed my life. 100%. I was, not only was I burnt out because of results, but at the time in New Jersey, we were dealing with a lot of insurance bullshit. In fact, right at that time, we had lost the ability to adjust extremities, which as a sports chiropractor, that was every single person that came in. Yeah. So that was huge. I think it was like almost 2 years that we couldn't adjust extremities. And I'm like, oh my God, what am I going to do? It was a nightmare. So we almost moved out. We were just trying to come up with ideas. So luckily that went away and I was fine, but that was going on, burnout with the practice. I was just like, I've had too much of this. And then NKT just kind of walked in my life and changed everything. And it's been a blessing. And I'm honored that David has asked me to be an instructor, and honored that he lets me continue being an instructor.
Oh, that's great. So Eric, just getting more into your office here, run me through kind of when you're bringing somebody into your office. I mean, do you give them any sort of pre-visit expectation, like with your first-time clients, do you give them like an email with a rundown of what you're going to do, or do you kind of just like let them come in blank page, have no clue, and you just work with them when they come in?
Yeah, I mean, they kind of come in and I don't really tell much. We have a website set up that tells about our approach. A lot of patients are word of mouth referrals. So they've gotten a basic thing. They have a kind of idea of what they're going to expect. But no, they come in and, especially people that have been to chiropractors before, they have a preconceived notion of what it's going to be. So that's a huge thing I have to kind of get through. Chiropractic in general is a tough thing. Some people don't like chiropractors. A lot of people don't. So I got to deal with that. So my first visit, I have them, everything I do with the forms is on the computer. So they come in, they fill out computer work, so by that time they're probably really annoyed because it's kind of a pain in the ass with these insurance companies. But then I come back and we sit down and we talk for a while. We start going through their history. I try to get their story down. Where are they coming from? What are they thinking? I try to get their goals down. I want to know what they can't do, what they can do, what their past history is, surgical history. You're just trying to get to know them a bit. Once I get to know them a bit and I feel like, okay, they've told me their story, which most people it's pretty good, but sometimes people want to talk for 3 hours, but I'll ring them in when they need to. But then once I feel like, okay, I've got a basic understanding of what direction I need to go, then I'll give them my story. I'll tell them what our approach is. and how, I explain basically about chiropractic, what general chiropractic does. And then I say how we're different and that we look for muscle imbalances, and that I use a lot of muscle testing. And I'm looking for things that aren't functioning properly. And when they're not functioning, I got to figure out why they're not functioning and look for something that's going to make it function better. So that way my treatment's going to be some muscle, some soft tissue work, and then some specific exercises, and then I might adjust them on top of it. So I kind of give them a basic rundown so they know, they're just like, oh, okay, that kind of makes sense. And then I'll put them through my assessment, moving. I'm always educating, always educating. Every visit, every patient, always educating, because I can't assume that they understand what I'm talking about ever. Even longtime patients, I'm still reminding them what it means when I find something weak. Okay, you're not weak. You could squat 450 pounds. Your glutes are firing. They're there. They might not be functioning when I'm testing them in a certain position, but we can make that a little bit better. So I'm constantly educating them on what I'm doing. And usually by the first visit, they got it down a bit. They see what's going on. I try to teach them a little bit about pain science, go through that a little bit, try to get, so many people come in with these negative things. Oh, I've got arthritis, or my posture is bad, or, the doctor told me 12 years ago I had a disc issue and I'm never going to be the same. So I try to break down through those things and try to educate people on why those things aren't right. Okay, you've got disc stuff in your lower back, but did you know that most studies show that people without pain have things in their back? Things like that. I'm constantly educating. So, NKT is one tool that I use in my office, but there's so many levels of things of education that you have to get through to people. Because like I said, a lot of people are coming in thinking I'm just going to adjust them and see you later. I mean, I had a patient last week. She came in with like 3 kids in her room, and she's like, and she put her kid down. She's like, okay, this will be done in like 5 minutes. I'm like, 5 minutes? I'm like, I've never seen you before. We've got to talk. We've got to go through this whole thing. She's like, oh, I didn't know that that's what you're going to do. The last chiropractor, he put me face down, blah, 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 blah. I'm like, yeah, you're in the wrong place for that. This is a totally different thing. And so, there's that level I've got to educate, which is why I say we're constantly educating, especially chiropractors in South Jersey. It's kind of weird down here. It's kind of like
kind of weird.
Yeah, it's kind of weird. So, there's a lot of re-education on what chiropractic is from my perspective, from a sports perspective. So NKT fits in nicely because it's not necessarily front and center, but when it comes down to what I'm doing, boom, it's right there. And that's basically every patient, every time. I mean, my basic thing on a follow-up visit, let's say, is visual assessment. I'm watching them move from my waiting room back to my office. I'll look at their posture. I'll put them through the SFMA, the Selective Functional Movement Assessment. That gives me some direction. I'll palpate them. That'll give me some ideas. And then I'll get them on the table and I'll start doing my testing, and that'll point me up. Core's off. Okay, cool. Let's figure that out. Up. Psoas is weak. Is it bilateral? Boom. I mean, that's kind of my approach with every patient, every visit. I find things, I fix them, give them some homework, and move them on. And, that's why it's constant education. And I think by the end of a couple visits, they got a good idea of what NKT was all about, what I have to offer. But, still, because I am a chiropractor, a lot of people think what I do is chiropractic. So they're like, does every chiropractor do this? I'm like, well, this is a little bit different than most chiropractors do. So that there, it is a weird thing in that as well, is that people think what I do is the norm of chiropractic now. Yeah. And I'm like, I'm not even close to what the normal chiropractor does. So there's that going on as well too, for sure.
Yeah, setting some good expectations though. Yeah. Well, so when you do start your NKT with somebody, are there like certain protocols that you always start off with in NKT, or maybe even certain protocols that you like would never go to, like, oh, I would never do this test with somebody on a first visit, or, oh, I always do these tests in a first visit?
Yeah, that's a good question. And that always goes back to our no absolute thing, is that I mean, again, I used to think a lot, I'm not going to do this, I'm going to do this, this means that, this means that. I now have gotten to the point where I have no expectations. I don't know where I'm going to go. It really depends on the patient. nothing is off game. I mean, if I think I need to go there, I'm going there. You know, and that's another thing NKT has given me is that confidence to use whatever I need to use when I need it. And not even that, but it's given me diagnostic confidence as well too. I recently had a patient come in with a shoulder issue that she saw orthopedic surgeon. Orthopedic surgeon said, "Oh, it's just bursitis." I'm like, all right. She had no range of motion in her shoulder at all, no resistance to any kind of manual muscle testing whatsoever. And I looked at her, first visit, just met this lady, sweet lady. And I said, look, I usually don't do this on my first visit, but I really think you need to get an MRI because I really am not sure that bursitis is what's going on here. Mm-hmm. And sure enough, she had a complete tear of her rotator cuff.
Oh, wow.
And she needed surgery in this case. Again, not always do, but she needed surgery 100%. Mm-hmm. So I don't know what the hell that orthopedic surgeon was seeing when he saw her, but, you know, she needed to do that. But because of my NKT testing, that really gave me the confidence to make that kind of call.
Yeah.
But generally, if we're going to say in general terms, I will check every single person's core on the first visit and on every single visit as well too, not just the first visit. It's got to be because I want to make sure that's working. And there's lots of reasons why the core can shut down, you know, and that's something I've learned over time. There's a lot of reasons why muscles could shut down. So I'm constantly looking at the core because if your core is not functioning, then everything else is going to be off. And I don't care if you have a big toe problem. On that first visit, I'm looking at the core. Now, if you have a big toe problem, I will touch your big toe on the first visit, 100%. But I'm definitely going to spend some time on your core. And the reason why core is such a huge thing is because core is 100% related to breathing. And as most NKT practitioners know now, breathing is extremely important. And almost every single person that comes into our office has faulty breathing patterns.
Oh, yeah.
It's mind-blowing. So first visit is usually core stuff and breathing stuff. Because if you're not breathing properly or efficiently, you're not going to be able to stabilize. And if you can't stabilize, you're not going to be able to move well either. So it's got to be breathing. So that's why core, breathing, I check in with my patients every visit on that stuff. Can they do it? Are they doing it correctly? And if not, we can't move forward. In fact, I just had a guy today that he's been seeing a bunch of other practitioners and they're all doing great work, but his breathing sucked. So I finally started over. He's like, yeah, but I want to do this. I'm like, slow down.
Yeah.
If you can't breathe and stabilize on your back, how the hell are you going to be able to deadlift or do this move or that exercise move? He looked at me like, I think you got a point there. Mm-hmm. I'm like, yeah. I'm like, those are all fancy, great exercises. And hopefully one day we'll get there, but let's peel it back a little bit. Let's make it a little bit easier. And, you know, that actually struck a chord with him. And because he keeps wanting, wow, give me something to do. I'm like, you just saw 5 different practitioners who gave you a ton of great exercises. I don't have anything better than that. Let's just peel it down and make it easier. Mm-hmm. So the one thing that everyone in my office has to do is breathe more efficiently.
Mm. Yeah, that's great. I'm curious how much testing you actually end up doing with people. I mean, when, you know, I don't know how long your session times are, but when you actually start doing the NKT and you started testing, at what point do you say, okay, you know, I tested some core muscles, I tested some muscles that are, you know, relevant to the issue, whatever the symptoms were. At what point do you say, all right, that's good enough. Now I'm going to start doing releases and correctives and different things. Or, you know, do you just keep testing a whole bunch of things? Like how much testing do you act on? And at what point do you say, that's enough. No more testing. I've learned what I need to learn.
Good question. So I like to use the SFMA to guide me through. And so if someone comes in with lower back pain and I find that they can't touch their toes and it's not painful, they just can't touch their toes. So it's dysfunctional, non-painful. That's the classification the SFMA likes to use and go for first. So if I have a dysfunctional, non-painful toe touch, person has back pain, I'll start with their core. I'll make a couple corrections. You know, maybe it's TVA is off, QL, multifid, whatever that relation, clean that up, get them up. I always like to get people up and walk around so they can integrate, and then I'll have them bend forward and touch his toes. If he could touch his toes, I'm like, all right, cool. Let's see what else. And I'll keep going through the SFMA. If they can't touch their toes, I'll keep working on that to see if I can improve that. I might do 2, 3, 4 corrections maybe for that one problem. And then I'll be like, okay, I think we're good. I've learned, my follow-ups are about 15, 20 minutes with a patient. And for some people, they're like, oh my God, that's not enough time. The better I'm getting, the more efficient I am, the higher priority dysfunctions I'm finding, the less corrections you need to do. And sometimes it's only one or two, and I find their nervous system, it's too much for them. So you've got to be aware of their nervous system. I've learned a couple tricks over the years from Thomas Wells, some things from him. I won't go into it, but some things from him on how to, assess patients and see when they've got to their limits. So I'll use those kind of things. But a lot of times you could just see it in people's eyes when they've had enough. But generally, if they made a big move, so let's say we go back to this person with lower back pain. Now he can touch his toes. I made one or two corrections. I might give them, okay, here's your homework. I want you to release your diaphragm and do this TVA exercise. Focus on your breathing and stabilization. Let's say maybe it was the SI joint to the glute max. Okay, I want you to gently release your SI joint and maybe do some bridges to activate that glute max. So I'll give them two things to do for homework, and then maybe I might give them an exercise to integrate those moves. Again, this is really dependent on their pain level because I don't want to push them past their neural edge. But if they're doing pretty good, I might give them an integrative exercise to kind of work on their toe touch. So I like an exercise called the reverse toe touch. I forget exactly where I got it from. A trainer, Eric Cressy, I saw has some kind of version of it. And I'll give them that exercise to try to integrate that movement. And that's basically it. So I'll treat them, I'll assess them. I'll do a couple tests. I'll find some things wrong. I'll make them make my corrections. I'll get them up, have them move, redo the SFMA. If we've gotten what I liked out of that SFMA, then we'll stop there. I'll give them their homework and maybe an integrative exercise. Okay, I can get that done pretty quickly, pretty quickly. Like I said, sure, you could spend all day assessing every muscle in the body, but after a while, the patient's going to get fatigued, whether it's muscularly or neurologically. There's going to be too much fatigue. So it does get a little tricky when people come in with 25 problems. They're like, oh, my big toe, my left arm, my this, my that. But those are the people that usually have problems breathing. So once we clean out their core, a lot of those problems go away. So that makes it a little bit easy to deal with those people. But I find with the time I have, I could be pretty efficient. I could do my testing, and no, I don't test every single muscle in the body. I'm pretty specific based on, again, my visual assessment, my postural assessment, my palpation, and then my muscle testing. All that stuff kind of zooms me in. I go from here to there. And that palpation component really is like, boom, that's where I need to be, right there. And then I'll test that area, and we'll work from there. So that's why, NKT is a tool. It really complements the other stuff you're doing. And it's made my visual assessment, my palpation skills, my gait assessment a lot better because now I'm bringing all those things together, not just in isolation. Oh, tight trap, let's release that. Oh, their walk is off. Let's strengthen that. No, we got to bring it together. Oh, trap is here. Their head movement's here, and it palpates like this. All right, now I'm going to focus on my test. Oh, testing showed me the trap was inhibited. All right, well, don't be releasing the trap. Release whatever needed to be released. And I think that since we introduced the directional testing protocol, I think that's been a huge game changer as far as getting people to understand why they shouldn't be releasing every little structure. It's tough, especially for the massage therapist, because they're on that muscle. They're like, oh my God, the trap's tight. I got to rub it. Slow down, test. And now they're finding with the directional testing that, the trap is inhibited. And that's where I think I see people like, oh, okay, I'm not releasing the trap. I'm going to release whatever else was. And that has really made things tremendously better for students to pick things up.
No, that's great. Eric, I just want to ask you a couple more questions. You've given a ton of great advice here so far, but just to kind of shift gears here into some other stuff, what are some good books or materials or things that you read in the past few years of learning NKT that it's like, oh, once I learned this thing or this other concept, or I read this book, that really made NKT a lot easier for me. I was able to understand concepts or protocols. Are there any good resources you can share that people can dive into?
Well, knowing your anatomy is definitely extremely important. And there's a lot of good resources. Kathy Dooley's Immaculate Dissection stuff is phenomenal. So I highly recommend that. But one of the books, which I always recommend all the time for functional anatomy, is Evan Osar's book. I believe it's called Corrective Exercises for Hip and Shoulder, something like that. And if you Google Evan Osar, Osar, you can find it. His chapters on functional anatomy are second to none. And the reason why is because he's based in DNS, which I haven't really talked much about DNS, dynamic neuromuscular stabilization, which is based on developmental kinesiology, which is basically how a baby moves in the first year of life. I just think that's extremely vital information. And Evan's stuff, and Evan's a chiropractor, his stuff is based on DNS and even more so on Voida. And Voida, Vaclav Voida from Prague, who's now deceased, but from the Prague School of Manual Medicine pretty much, he developed a technique based on developmental kinesiology, and DNS, collage of DNS is basically the second generation of Voida stuff. But Evan's work is based off that. That stuff really rings true to me, that, you know, before you could do anything, you need to breathe. First thing that a baby does is they breathe. You know, you need to move your eyes. You need to move your neck. You need to move your shoulders. You need to roll. You need to crawl. You need to stand. You need to squat. You know, those things really speak to me. And Evan's work is based on that, and based on not just looking at muscles from origin to insertion, but what happens when you're pushing off to stabilize. What is the muscle doing? You know, we know the bicep does this, but in a different position when you're crawling or pushing off, the bicep does something else. So that kind of stuff was really instrumental into me looking at things from a different perspective. So I really like Evan Osar's book. The other go-to book, which, you know, it's getting a little bit old now, and there's definitely some changes too, but Gray Cook's book, Movement. I spent lots of time reading that. I have the hardcover. I have it's on my Kindle. I mean, I've gone through that book a million times. So it just getting my brain to think from more static to dynamic is really what that stuff is good at. The functional movement screen, the SFMA, those kind of things have been vital. The other good book that I really like, as far as understanding gait and mechanics, I don't know if we could see it there, but Human Locomotion by Mashad. He goes through anatomy and biomechanics of every muscle and every joint in the lower extremity during gait. It's phenomenal. I had the pleasure of seeing the guy speak. It was pretty amazing. He's just a brilliant guy. That book has been great to me. Another book on a different note, things that, again, I think as clinicians in dealing with people with pain, is we have to start to understand pain and pain science. That's a huge thing these days. And, you know, I'm sure a lot of us are familiar with the whole pain science community, and they could be harsh, some of the people on, and very critical on a lot of the stuff that we do, you know, especially with manual muscle testing. Those people aren't a favorite. So I think it's important to stay up with current pain science. So Explain Pain is a good book. In fact, I just ordered Explain Pain Supercharged, that kind of stuff. I just got a book. The next book I'm going to read right here. It's called A World of Hurt, Classifying Pain. So, you know, I think we need to stay abreast of that kind of stuff. So that's kind of cool, because, you know, I love NKT, but as I always tell my students, it doesn't have the answer for every problem. I mean, we can help a lot more problems. We could totally help a lot more problems, but there's sometimes people are going to come in and NKT isn't appropriate for them. So I want to know what to do when those patients show up. You know, I want to get better results. So I'm reading all kinds of things. I'm learning different techniques. I'm trying to be the best clinician I can be for my patients. And I think part of being a good NKT practitioner is realizing you're not going to solve everyone's problem with NKT. You know, and that's where I think people get pigeonholed. Oh, I tried NKT and it didn't work. Well, I don't know. You know, who is the person that did it? Is that all they did? Did they have the right perspective of it? You know, because NKT is a tool. You know, I'm a chiropractor, but I don't just adjust people. There's a lot more to chiropractic than just adjusting people. You know, and it's the same thing with NKT. It's a tool. It's more of I like it. It's a thought process. It's a philosophy. You know, that's what NKT has done for me. It's opened up the potential for so many possibilities. Man, is it an Olympic issue? You know, is it a biomechanical issue? What's going on? With our testing, we can kind of go those directions and see where it is and get to our limitations. I mean, if it's a true limbic issue, then I can NKT the crap out of someone. It's not going to make a change. You know, and I see that every so often in my office. Someone comes in tears, stressful day, you know, a problem with their spouse, and everything's a mess. Well, unless they calm down, I'm not going to get any results out of this person. So I've got to use other techniques to get them to calm down so that I can then use NKT. And once in a while, I can't even use NKT because they're not calmed down enough. So I think a good practitioner is one that knows how to use different tools and when to apply them. And I think with experience, you'll get to that point for sure.
Yeah, definitely. That's great. Eric, do you have any just last word of advice that you can give to the students of NKT?
Last words of advice.
Like maybe a motto that you have, or something that you keep in your head, or even just maybe a good story to share.
Practice, practice, practice. You just got to do it. You got to do the repetitions. It's not difficult. The more you do it, the easier it gets. One big piece of advice I tell my students right from the beginning is that they should purchase David's muscle testing videos. There's one, it's $50, and it shows every test that we're going to teach in class. And, he gives you clinical pearls. There's no way you could possibly learn every test in one weekend. It's not going to happen. But if you learn how to feel things, you learn neurolocks, you can do anything. You could do any test. So if you can watch those videos, that is tremendous. That'll help you tremendously. One other piece of advice too that I'll say, and I just had a comment on someone's post about it, and I do share this with my patients, with my students as well too, is the first thing as any kind of practitioner, however we are, a chiropractor, physical therapist, medical doctor, massage therapist, whatever, yoga instructor, is the first thing we should be thinking when a person walks in our door and gets on our table is this person appropriate for my treatment today, right? Is there any red flags going on that this person shouldn't be in my office? And I see that, like this, I told you that story about the woman with the rotator cuff. She wasn't appropriate for my office. I had to refer her out. I've had people, I just got in a car accident. My neck is killing me. Go to the emergency room and get an x-ray. Those are things, if you're a trainer and someone comes in with a car accident the day before and hasn't seen anybody, get them out of your office. I mean, it seems like common sense, but sometimes it's not. We need to be dealing with identifying if there's any red flags. And if there is, send them out. And just a brief story, which again, I always share with my students, is I had a patient about a year and a half ago come in. He's someone I've seen since day one in practice. He's a friend of the family. He comes in every couple of years with back pain. 2 or 3 visits, he's better, and I don't see him again for another year or 2. This time he came in, and it was like December. He came in for a couple of visits. He felt better. I didn't see him over the holidays. He came back at the end of January, and he was like, I'm like 100 times worse. I'm like, all right, that's kind of weird. And he was kind of bent over, kind of like an antalgic position, kind of like a disc issue. But he had no disc symptoms whatsoever. There was no weakness. There was no numbness. There was really nothing that thought disc. So I'm like, all right, let me do my thing. Did my thing, make some corrections, got up, no different. I sent him home. I'm like, all right, let's see what happens next time. Came in like second visit, he was worse. He was actually bent over more.
Wow. I'm
like, something feels wrong, but it doesn't feel like a disc. And that's all I was going on. It's got to be a disc, even though it didn't make sense. So I'm like, let's do one more treatment. We'll see what happens. So I did another treatment. Same thing. Came back. Maybe it was even worse as far as bent over, and the pain level just hadn't changed at all. I'm like, let's get an x-ray. Got an x-ray. Looked good. I'm like, all right, let's get an MRI. I mean, next day I had it because I'm like, his pain is ridiculous. Got an MRI. Came back. In fact, it didn't even come back. The radiology place called me to let me know that he had stage 4 spinal metastatic carcinoma.
No
it was
way.
pretty crazy. He passed away a few months later. It was nuts. It was nuts. And, here's a guy that's been coming in every few years for similar type of thing, but, he responded like that. So I share that because you never know who's going to be on your table. And you need to be aware in this case, it was just a feeling like he wasn't responding. That was the red flag. There was he had no signs, no injuries, nothing out of the ordinary. It was just, it didn't feel right. He wasn't responding like he usually does. So I share that with the hopes that that's just running in the back of your head when someone comes in. is this person appropriate to be in my table? You know, if they are, then knock yourself out. You know, maybe they were in a car accident 3 weeks ago. They went to the emergency room, nothing. They went to their medical doctor. They gave them some painkillers. They went to their chiropractor, physical therapist. Nothing helped. You know, now you're a massage therapist and they came to you. Well, not, you know, again, still thinking, because people can miss stuff. Is there any red flags? Once they're ruled out, knock yourself out. It's totally appropriate for them to be on your table. But if they were in a car accident the night before, probably not appropriate. They should probably get some kind of clearance.
Right.
And like I said, that goes for me too. You know, as a chiropractor, I know my limits, and I'll refer people out as soon as I think they can. And I think if we all keep that in mind and we stay in our lanes, I think we'll be doing the right thing by our profession and more importantly, our patients. And I think that's the most thing here. So please consider red flags. But as far as NKT goes, you know, stick with it. It gets easier. If you have troubles, reach out to someone. We've all been there. You know, look at the scholars page, look at some of the cases, do some searches, look at Thomas Wells' pro tips. You know, like I said, reach out to your instructor, reach out to your study group leader. We're here to help you people learn this stuff. We've learned it, and that's what I mean. If I learn this stuff, as I said, I never really used muscle testing before. Now I'm an instructor. If I can learn it, I'm pretty sure most people can. So just stick with it, practice it. It has its ups and downs. You'll get frustrated. There's some days you'll feel like you have the answer to all the world's problems, and other days you'll feel absolutely useless. I've definitely been there myself. You know, I always get that image of me running around the table for 20 minutes, perspiring, trying to figure out the psoas. You know, and on that, I might as well share one more story just because I do like sharing these stories here. And I always share it with my students, especially in level 2. I was doing my level 2 certification with David. There was no one else doing them at the time, so it was just David, and the patient had she came to me for neck issues, but she had I think it was like a stage 4 prolapsed uterus, pelvic floor. I mean, it's pretty significant. And, you know, I asked her on the intake, I said, hey, do you do the Kegels? And she looked at me and she gave me this like, I'm like, oh, I'm like scared. And this little woman, she was like 5'10", maybe 125 pounds, looked like you could flick her. And she had this thing, and she got this look, and I'm like, I will never ask you that again. And I'm like, well, you know, give me some more history. Well, apparently she has a quadriplegic son that's like 80 pounds, so she's lifting him all the time. And then again, small little 5'10", maybe 125 pounds soaking wet. She squatted over like 350 pounds and deadlifted 400 pounds.
Whoa.
You never would have guessed this looking at her, but I can understand why she would have a prolapsed pelvic floor. But I remember when I was testing her, I couldn't find any weakness with the pelvic floor at all. It wasn't making sense. I'm like, what the hell is going on? Now, mind you, I'm doing my level 2 certification, and at the time, pelvic floor was part of that. And I'm like, I'm dripping sweat. I'm in my office. I'm like, oh my God, I can't figure this out. David's on Skype. I'm testing. I'm testing, and I can't find anything. And David's like, Eric, calm down. I'm like, all right. So I was testing the core. He's like, test the core again. So I go, I test her, and nothing. And next thing I know, he's like, Eric, look again. So I'm testing the core, and I see she's grabbing the table with her hand. I'm like, oh. So I go, and long story short, it turns out her fingers were facilitated for her pelvic floor.
No way.
It was crazy. I mean, think about how much weight she's lifting on a regular basis, right?
Yeah.
She's grabbing with her hands. So I released her hands and step back, and I step back, and I'm like, all right. I'm like, can you do a Kegel exercise? and she did, and the tears just came down her face. Wow. And she's like, for the first time in 5 years, whatever, I can actually activate my pelvic floor. Wow. And it was pretty mind-blowing. So again, big lessons out of that was stay calm, keep a soft focus, you know, and just look, and you'll find the thing. It's not so difficult, but we get so fired up about why is that psoas weak or why is this muscle not working that we sometimes miss the bigger picture. And I was being tested, I missed the bigger picture that she was obviously grabbing the table with her hand. I mean, that's a rookie mistake. And here I am on my level 2 exam, totally missed that. So take a breath, step back, and see what's going on. The answer is right there in front of you, right on your table in front of you. You just have to pay attention, really.
Yeah. Yeah. Well, Eric, this has been great. Thank you so much just for sharing all this information, your stories, your advice. It's really been great, and just a pleasure and an honor to speak to you and hear all your wisdom. Thanks so much for being here.
I appreciate it. If I might just say one last thing too, as well as I applaud you for doing these webcast things. It's great. For a while I did a podcast where I was interviewing NKT practitioners. I think I did about 29, 30 different episodes, and it was great. I loved. I called it Inside the Brain of, and I would interview some of the similar people that you interviewed, Thomas Wells, and some of the different Kathy.
I loved those. Yeah,
even Perry Nicholson.
People should look those up and find them. They're great.
And they were so enjoyable because I really got to the core of, how they utilize NKT in their practice. And unfortunately, with 3 kids and businesses, things, life catches up to you, and I didn't have time. So I was honored that you asked me to join you here, and I was very excited to have this opportunity to speak, because we have such an amazing community in NKT. It's absolutely wonderful. And I know David isn't a big fan of the symposium idea, but when we had a symposium 2 Septembers ago, it was phenomenal. We connected in face with people, and I made some friends there that I love absolutely dearly, and they'll be friends for the rest of my life. And so it's just amazing, when I'm on Facebook and I have chats with people and we joke around. I mean, it's been such a huge part of my life. It's just such a great community. And I know that if I have issues with patients, I know I have people and resources I can go to. I'll ask David, I'll ask Thomas, I'll ask anybody, for some insight depending on the issue. Jordan Terry, who specializes in cranial stuff, I've Skyped in a couple of times so he can give me some cranial insights. So the community is absolutely phenomenal, and I'm honored to be a part of it. And again, thank you for having me on this program. I greatly appreciate it.
Yeah, thanks. It's been awesome. Thanks, Eric.
All right.